ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ECDC On Air. I'm your host Nicholas, and here with me today I have Cornelia Adlhoch, who is one of ECDC's experts on influenza. Welcome, Cornelia.
Hi, Nicholas. Nice to be here.
You've been here with us earlier to talk about avian flu, but today we're going to talk about the seasonal flu. When we record this now, it's the middle of October. How concerned do you think that we should be about the flu?
Influenza has not really changed now over the last COVID-19 pandemic. So influenza is still influenza, and we have seen a large and high burden in the population pre-pandemic. And so whenever there is influenza circulating, we will see people getting sick, having to be admitted to hospital, and even dying due to flu. Before COVID-19 was there, influenza had the highest burden in the population. So of course, influenza is a disease where we are concerned and where people are infected and affected on different aspects, particularly also healthcare, on the healthcare system, that when now influenza might circulate plus COVID might circulate, we could see that additional pressure is put on the healthcare system as well.
And people tend to think of flu as something that's not really that dangerous normally. And I remember in the beginning of the pandemic, some politicians were saying COVID-19, it's just like the flu, it's nothing to worry about. If people make that kind of comparison, it sounds as if flu really is nothing to worry about. But what would you say to that?
Before COVID, flu had the biggest burden in the population every winter season, with a lot of illnesses, but a lot of hospitalizations and death as well. And even though when influenza now has been circulating on low levels over the last two COVID pandemic seasons, there were even still at least, I think the US calculated that 6,000 deaths were attributed to influenza and 10,000 were hospitalized. And so I think the same numbers can be used on also for Europe. We don't have the very comprehensive system, but we monitor flu. And we know that we have had also hospitalization and death related to flu, even though having COVID as still the bigger brother with a higher severity, but flu still causes a high burden in the population.
Is there anything we can say about the concerns about a dual pandemic with flu and COVID-19?
So, and when talking about the co-circulation of influenza and SARS-CoV-2 over the winter period, we have had the experience over the last 2 years that we have not really seen parallel waves where influenza and COVID-19 would have peaked at the same times, but we have rather seen a change in the pattern. And that might be that one virus has advantages to be the first to be able to infect the population, and then when this advantage over time diminishes, then the second virus, like for example influenza, can come back and circulates in the population.
That's fortunate for us, I guess, then, because if we would have two peaks coinciding at the same time, it could be potentially quite severe consequences, right?
If the peaks are different at different time points, it will still add into the burden of the disease, particularly on healthcare. Patients that are hospitalized, they will not just be 1 week in the hospital, but will probably stay longer in hospital. So whenever then another wave of respiratory virus infections come, that would also cause additional patients to that are required to be hospitalized. So that adds, of course, into the burden on healthcare overall.
Can you then tell me a little bit, what can we expect from the upcoming flu season?
In general, influenza cannot really be predicted. And now having had two exceptional influenza seasons since the start of the COVID-19 pandemic, it is even more difficult to really make a prediction for the next season or for the upcoming season. While we have seen for the last year, for example, a very low and very late influenza circulation, which reached even into the summer period, and where we have also seen detections and outbreaks in countries which are rather holiday destinations than influenza hotspots during the summer. So what we are also seeing in several regions in the world is that early detections are reported. So there is some speculation that we will probably, or that we could see, early start of the season.
And what do the forecasts say in terms of which type of flu that is likely to dominate this season?
So last season we had a very H3N2 dominated season, which usually affects more the elderly. But what we have also seen now over the last couple of months in different regions of the world, that a more mixed picture has been developed with more H1N1 PDM09, so the pandemic H1 virus, but also B viruses popping up. And we see the same picture now also in the latest data with a more mixed picture with H1, with H3, and with B viruses. So it will be an interesting season which virus will be dominating, or if we see 3 viruses co-circulating at the same time.
Can you tell me then a little bit about the best ways to prevent flu from spreading?
Influenza is a respiratory virus, and I think we had a long lesson over the last 2 years how to prevent respiratory virus spread. So what has been true for COVID-19 is, of course, more than true for influenza, like avoid crowded places, and if you need to go to crowded places, use a face mask, stay at home when you're sick. That is, I think, the most critical part, not to spread your own bugs and to share your own bugs with others. Keep distance, have your sneezing and coughing hygiene, so use your elbow instead of your hand. And hand washing is also one of the measures that is, of course, not only helpful against influenza, but to many other diseases and pathogens as well.
And vaccination, I understand that's something that's quite important as well.
Vaccination against influenza is, of course, a very important measure, particularly in the elderly, to prevent severe disease and also death. But also for risk groups, we have recommendations in many countries that should get influenza vaccines early when the season starts to prevent severe outcomes.
If people then get vaccinated, how effective is it actually?
We have seen different effectivenesses against the different virus subtypes and lineages. So the data for last season was quite good against the H1 PDM09 viruses, lower for the H3N2 viruses, where we have also seen in the past that the vaccine components have some limitations there, particularly in the elderly, and we also see a waning of immunity over the season. So what we have also recommended last season with the H3N2 circulation, that also antiviral treatment is a measure to protect the elderly when there are outbreaks, for example, in long-term care facilities, to prevent severe disease.
We've seen now over the last year or two that there's been really a lot of outbreaks of flu in birds and poultry. Is this something that we should be worrying about now during this flu season?
I must say now the avian influenza situation has continued over the summer with unprecedented outbreaks up to Svalbard, to Iceland, and even down to Portugal and Spain, which we have never seen over the summer season. So we still see a lot of outbreaks happening at the moment, and we are now facing having the migratory birds coming back from their summer breeding sites into Europe, into their overwintering sites. So we will probably see more introduction into that one. But the key thing is that for the general population, we don't see a large risk at the moment for avian influenza, but it's very critical to still keep the awareness for the potential of avian influenza viruses spreading to humans and transmitting to humans. So therefore, surveillance and monitoring and testing is very crucial. But this is most likely only targeted to those which are exposed to infected birds, for example, when there are outbreaks happening in a farm, or if there are wild birds dying on the coastline or in the wild, and these are then picked up and destroyed. So for those which are really directly exposed to birds.
We talked a little bit earlier about the COVID-19 pandemic and the effects of that. I would just like to understand a bit more. Is there anything that we can, take as lessons learned from that and then apply to influenza? Because both viruses are respiratory viruses and in some ways are a bit similar. Are there any lessons learned that can be applied?
We have seen that all of the measures that have been applied to lower the circulation of COVID-19 was able to nearly completely avoid a whole influenza season during the winter, and now has also disrupted kind of the circulation of influenza, as we have known how influenza circulates in all of the pre-pandemic years. What we have also seen that all of the measures work to lower the spread of influenza. And what we have also seen for COVID, that vaccines work pretty well to prevent the severe disease and fatal outcomes. And that is also true for influenza. So that is also a reminder that all of the measures that have been now implemented over the last 2 years against COVID are very well suited to fight flu.
Do you think that the COVID-19 pandemic has changed the general public's perception of flu and its risks? I mean, for example, we've had the COVID-19 vaccination fatigue and misinformation that's also impacted on people's willingness to take the flu shot. Do you think that's the case?
I would rather think the opposite. I think the last 2 years have been a awakening call for the population to really understand the impact and the importance and the severity of respiratory viruses. Having so many people also having suffered and having had COVID-19, being hospitalized probably, or knowing people who have been in hospitals or having even died. And what the data now shows also that there is still 75% of the population still believe that vaccines, for example, are safe and effective. And I think that is what we have been expecting already also before the pandemic. And I think this perception has not much changed over the last 2 years, having also the very intense experience with the implementation of the COVID-19 vaccination programs. And still the majority of the population is very well aware and positive for vaccination.
So do you have any final words to our listeners now for the upcoming flu season? What's the best way to be prepared for that?
To be aware that it's not only COVID-19 that is circulating, we have also influenza and we have other respiratory viruses circulating. So best is get your COVID-19 update according to the recommendations in the countries. Get a flu shot to protect yourself and the people around yourself. And think about hygiene measures like hand washing, sneezing and coughing etiquette, and staying at home when you're getting sick.
Okay, great. Thanks a lot for that advice, Connie. And I hope to have you here at some other point.
Thank you, Nicholas. It was a pleasure. Bye-bye.
We hope you enjoyed listening to this episode of ECDC On Air. For more information about ECDC and its work on influenza, please visit us on ecdc.europa.eu, where you can easily click yourself through to our dedicated seasonal influenza pages, or follow us on social media.